We're here in Queens Hospital. It's a public hospital and it's been hit really hard by COVID-19. And today is a big day for one of the ICU patients because he's finally getting discharged after spending a month on a ventilator. Hospital staff called Rudy Corletto the Miracle Man. The 68-year-old grandfather and retired car painter stayed for 42 days, 29 of them on a ventilator.
The fever wasn't that bad. There's coughing and weakness.
He had the signs and symptoms of someone with a cold. I didn't think much of it until he got confused. Once he got confused and he thought he was in his country, Dominican Republic, I said something's off. When I brought him into ER, it was just mayhem in there. They said the next step is intubation.
I was like awake all night, like 5 or 6 days. That I watched hours go by. I couldn't sleep.
After being intubated, the odds of surviving COVID-19 are low. According to New York State officials, 80% of patients placed on ventilators haven't made it. Was there ever a point when you thought that you might not walk outside this hospital?
Yes. I still can't believe it.
As his condition worsened, Rudy received an experimental plasma treatment.
Basically, a patient who's had COVID, they donate their blood, and then it gets re-engineered and processed so that it can be infused into a patient who's fighting COVID. And that burst of antibodies theoretically can help to fight the infection. It doesn't necessarily work with everyone, and in Rudy's case, it worked.
Dad, are you okay? You don't feel your blood pressure's dropping now?
Maybe.
Okay.
What did it feel like when you started to breathe on your own again?
Just feel like I'm back alive, you know.
Oh, Jesus, we got one. After last night, we needed this. You too. Yes. You have no idea. People just don't know.
So while I have him during the day, Demetria have him at night.
All night, for just weeks on end, and
Weeks back and forth, back and forth.
You need a success story. You just need one success story, and that makes everything worthwhile. We leave our kids, we've left our home, we left our everything, and so to see him just get to go home just makes it all worth it. Like, yes, Jesus, I love you too, girl. We're gonna get that number 3 home too. Get him home next. He's next.
Demetria and Courtney were Rudy's primary nurses in the overwhelmed COVID wards of Queens Hospital, which has seen more than 1,000 patients. Courtney came all the way from Georgia to work here, Demetria from Florida.
It's the right thing to do. It's the right thing to do at the right time to do it. So the middle of a pandemic, I figured I'd get my feet wet, and here I am. My family did not want me to come. Like, why would you leave the safety of home and go somewhere where you know is the hot spot or the hot zone or whatever? And I told them, this is what I do. I'll be okay. You worry about those people that I'm going to care for. I'll be okay.
How is all of this work affecting you emotionally?
It's a lot. I have nightmares, especially from those first 2 weeks. It was very hard in the beginning. It was emotionally draining. You talk it out with your friends at work. You get it off your chest. You try as much as you can to leave it here, so that way when you get home, the thoughts aren't crowding your head.
Hold the sign up, Dad.
What's your message to all the medical workers who helped you get through this?
Thankful. For me, they saved my life. Grateful.
What does it feel like to watch one of your patients finally walk out those doors?
You say patience. Rudy is the only one I've witnessed walk out of these doors. I truly don't know if this man wouldn't have made it if I could have stayed working, because it's so emotionally draining. It takes everything out of you to fight for these people. We needed this as much as his family and him. Our morale needed this success story.
All right, Dad. Yeah.
What are you most looking forward to when you go home?
Stay with my family, my dog. The dog is depressed.
Your dog is depressed.
He's depressed because he hasn't seen me all these days.
Ready to go home?
I'm ready, more than ready.